Hi, today I like to share with you all how childhood trauma affected my life. So I was affected as by childhood emotional neglect, childhood sexual abuse, and also Sri Lankan war. And all these has caused the childhood trauma in my life. So, at when I was 5 months old, I was taken away from my mother. So that was the first trauma I had. Even birth might be a traumatic event. Then childhood sexual abuse happened at the age of 8, and the war happened at the age of 7. So, as a child, I was severely all the somatic symptoms, sickness. I had headache. I had eye, pain in the eye, toothache, earache, stomach pain, diarrhea, asthma, vomiting, rashes. So you can, almost all the things were there. And also for headache and all, they couldn't find the proper reason. Even at the age of 17, 18, I used to have back pain, and that also nothing. Like all these struggles I had physically, it was just a symptomatic treatment at that moment, but there was no any cause was labeled. Like, I was it was just I go time to time get the medicine for those kind of things and come back, but I was not like on a prescription drugs, or diagnosed as particular problem of disease. Then the second thing is I had suicidal thoughts. As a teenager, I attempted my suicide suicidal attempt. I wanted to die kind of thing. I was trying, but I never had the courage to do it. Later on, I was able to have the courage to attempt and do it. But so that was suicidal thoughts were, and I was also depressed, but I still went to school. I still performed very well because there was no space for me to refuse to do anything. I have to wake up and I have to act and everything. But actually, if I was alone by myself and have to make a decision, I think I could have just stayed in the room inside, in the bed, because I was basically I couldn't, but I was forced to go. And I used my books studying as an escape. Like I was able to connect with my education to disconnect from the trauma. So it is a way of kind of coming out of the a traumatic event. But actually, uh, as a person, I was not in a position as a child, very very depressed, I can say. Now, as an adult, as a medical doctor, when I look at myself, I can clearly give a diagnosis that, she was so depressed. But at that moment, mental health was not even talked about, depression was not talked about. So I was, there was no any even a anybody to think, even a child can have a depression. Then other thing is also shyness. Like I was isolated, so that comes from the childhood sexual abuse. Like, I was so I didn't have much friends. Like, I will be among with them. I don't talk. I don't have the clear communication or, anything. Like, I don't argue with anybody. I don't, that's why still my school friends, they don't have any problem with me because I never had fights with them. I was simple, I agree. I obey. I was very good child in a way. I was so, fit to the society. because my childhood trauma mode was freeze. So I never fought. Escape also there, but it was also not very much. But freezing was my style. But so I will be present anywhere, but I will be frozen. So memories may not be, I can't remember certain events and all. And also, I was a very sensitive child. I was even 2024, I attended a school reunion, and one of the classmates said how I was crying in the school. So very very sensitive child, and deep down the pain, whenever somebody said something or did something, it just came out, like, I was able to cry it and let it out for small things. Actually, the pain was something so deep that I never had a chance to cry about or cry for. So other things made me to cry and let it out. And I also see the reactions from the body, rashes, pain, and everything. It was a survival, actually. And also crying for petty things. Also, I feel that I used it to survive. So actually, it was a very, very difficult childhood, not for other people. They all liked me, loved me. But for me, with all the pain inside, with the physical problems, with the mental, depression and sadness, and extremely, and also I used to disappear in a way. I kind of, I was in an imaginary world. I used to imagine, and that is how I was able to liberate myself. I was able to find safety. I was able to find joy. I was able to find the hope by living in an imagination world. And actually, I'm grateful I was able to do that, like a coping mechanism to, but actually it's not the healthy way to live. You can't just, because as an adult, all these childhood effects, when we become an adult, when we become in a position, authoritative position in a place, people won't accept us if we are in an imaginary world, if we are having sickness all the time, if we are so sensitive, if we don't know how to say no. And also it, all these things, even if it was a coping mechanism as a child, in adult life it affects us in a very high way. We can't fit in the society like the way we fit ourselves as a children, because in an adult way they expect us to behave in a different way, and we don't know how to behave because our way of style is, due to the trauma, it is different. So that is the overcoming part, to heal the trauma, to overcome the childhood trauma. Then we can live in the adult society as an adult, no longer anymore as a child. So that was a journey I have to go through, but I have to acknowledge and admit the struggles I had, and I'm grateful I'm able to overcome those things. I don't have any more any suicidal thoughts. My physically, I'm perfectly fine. Time to time things can come, but I don't struggle, in any stomach pains, headaches, anything like that, nothing severely. And also depression, I'm able to take care of myself and live a happy life for myself. So it is a journey to live in the present, totally owning myself and living in that fullness of myself. So I'm also grateful for that child, that who has been able to cope through this trauma and find able to liberate her to find this freedom. Thank you.